So Matt brings up the question of, well, what if your patient is asking, am I going high enough, or should I go higher, or I feel this in my back, what do I do? So let's do this. If the patient is arching their back, so arch your back the wrong way, and now lift up. And keep going, keep lifting, really arch your back, arch your back. She should be feeling a whole lot of compression right here because she's doing it incorrectly. A couple different things that we can do. Number one is take those knees and push them that direction really far. Take your knees, there you go, and you can feel how that lengthens you. You should be able to see that. Now don't push your knees that way. Yep, and she drops back down, plus yep, there we go. Plus she's not arching as much. But that would be the first thing. If you feel like, if someone's complaining that their back hurts when they do this, that means that they're squeezing their back. They don't need to squeeze the back. Remember that most patients who have been to therapy elsewhere, they teach them exercises differently. Or if they've been to some sort of exercise class, right? And what you can say is, so patient, I know that's how you've always done a bridge in the past. Probably we need to change that because it hasn't worked for you for stabilizing, and that's why your back still hurts. And that is a great way to be respectful of what's been done in the past, but to say, hey, at this point now we need to take a new track. Second thing is, how high do we lift? So if you've got somebody who only has a certain amount of hip extension, lift up again please, when we get to keep going, if I want her to keep going but she doesn't have enough extension through her hip, she's gonna then have to get it through her spine. So arch your back, do it the wrong way. So arch your back, stick your butt up, there, okay? And that, of course, is lifting at the wrong spot. We don't want to compensate, so come back down. So you just watch them, right? And you have them press their feet down into the ground, press your feet down into the ground in order to lift the buns up. There you go. Push your feet down into the ground in order to lift up. That should also take out a lot of pressure of the low back area. Drop down. Okay. Any other questions about this? Okay, so far so good. We'll come around.